When discussing the topic of pet euthanasia, there is really no easy way to address it. It's a pretty sensitive subject. We, as caretakers and veterinarians of these animals, have been blessed with means that we can stick by their side and strive to do what is best for them. As a veterinarian, I take an oath to advocate for my patients and give them the best health care I can while emulating dignity and respect. The sad reality of pet ownership is that part of life's journey includes the way our pets leave this world and cross to the Rainbow Bridge. We bear the responsibility of not allowing pain and suffering if a pet's quality of life is diminished to the point where they are unable to perform basic functions. Pet euthanasia is the humane process of ending an animal's life by a veterinarian to relieve suffering or remedy an incurable circumstance. The term euthanasia comes from Greek roots meaning good death, reflecting the intent to minimize pain and distress. In this video, I will discuss three main aspects of pet euthanasia: the ethical requirements, the humane process, and the legal awareness. First off, the ethical requirements. When considering euthanasia, keep in mind that it is a last resort that we as veterinarians and owners consider. Thanks to the advancement of modern medicine and animal behavior training, we are able to consider euthanasia less often than we normally would. Modern medicine enhances the quality of life for the pets and also the humans. There are only two reasons that euthanasia is ethically the right thing to do. First off is the quality of life for the pet. When medicine cannot sustain a healthy and productive lifestyle for the pet, both physically and or mentally, often pets suffer in pain and discomfort. The best course of relieving this suffering is through euthanasia, where they get a respectable exit out of this life. Incurable conditions such as kidney failure, cancer, degenerative myelopathy can drastically reduce and decrease the quality of life of a pet. No pet deserves to suffer, and we as pet owners do not like to see our pets suffer. They rely on us to make the decisions to do the right thing. Second, when a pet becomes a danger to others and behavioral training has not been successful, then we also have to consider euthanasia. These types of decisions are not taken lightly by pet owners or veterinarians. Most of the time, these types of euthanasias are because of circumstances beyond our control. Dangerous and aggressive dogs make the dog's owner's life unstable, the dog's life unstable, and sometimes both of them unmanageable. An uncontrollable dog exhibiting destructive behaviors increases the likelihood that the pet owner or a child could be bitten, and at times results in gruesome attacks, which can be life-threatening for other animals and humans. We tend to humanize dogs, but we always have to remember that at the end of the day, though dogs have become domesticated, they still have those ancestral wolf instincts of survival and fight. One more thing to keep in mind is that an aggressive animal is also suffering, as it cannot live a normal and productive life. Locking a dog away for years with no normal interactions only exacerbates the issue, not corrects the issue. This is a sad situation to be in, but it is part of proper pet ownership and responsibility. Number two, the humane process. Veterinarians are encouraged to use a quality of life assessment, such as the quality of life scale, to help pet owners determine when euthanasia might be the most humane options. Discussions about end-of-life care should be compassionate, focusing on the animal's needs and the owner's wishes. When I see my clients coming to me for the euthanasia procedure, I take the time to assess the patient's condition, make sure that the pet owners are aware of their options, and give informed consent to the procedure. I explain every step of the process beforehand so pet owners can be prepared ahead of time when it's time for the final goodbyes. The procedure usually involves an injection of an anesthetic overdose, causing the pet to lose consciousness quickly and pass away peacefully, typically within a few seconds to a couple of minutes. First off, I will administer a sedative to help the pet relax, reduce any anxiety for both the animal and the owner. After that injection, the animal does not feel a thing. Once all the medication has been administered, I use my stethoscope to make a final determination that the procedure has concluded. At that time, pet owners are given several options of how to take care of the remains. These include home burial or cremation option. We as the veterinary staff understand that this process can be a difficult process, and we commit ourselves to provide compassion and empathy for each and every end-of-life decision. Number 3 is the legal awareness. Euthanasia cannot be used as a form of punishment or cruelty. Performing euthanasia in a way that causes undue pain or suffering may constitute as animal cruelty and is illegal. Only approved methods and trained veterinarians may carry out euthanasia. This means the days of dispatching a dog at home or on the farm are not permitted and are illegal to perform. In conclusion, pet euthanasia is meant to be our last act of compassion in an animal's life. Please don't let your pets suffer in pain and discomfort. Always put your pet's needs in perspective and always consult with your veterinarian so you can make an informed decision regarding whether or not it is time to euthanize. My name is Dr. Liz Wolf. I am a veterinarian at the Perry Veterinary Clinic, and this video is brought to you by the Animal Friends of Wyoming County. Thank you for watching this video brought to you by the Animal Friends of Wyoming County. Please like this video, subscribe to their social media, share with a friend, stream the CHOW podcast, and consider giving a tax-deductible donation through their website, www.animalfriendsofwyomingcounty.com.